So I will tell you that I've actually been a member of East since 2015. I joined as a resident, and for many years I would hear about this meeting from my faculty, especially from past president of East, Dr. Elliott Howe, who was my attending at the time. And he would tell these legendary stories about this meeting and how there were trauma surgeon leaders wearing Hawaiian shirts and playing dodgeball. And for me, it was this amazing thing that I had this vision of in my head. And I knew someday I've got to get there and I've got to see this for myself and be a part of it. So for so many years, I wanted to come to this meeting. I've got to get to East. And I finally attended my first meeting in 2019. It was in Austin, Texas, and I remember it very well because I actually was allowed to come as the East Orion Scholarship winner. East supported my travel to the meeting, and that was the only way that I was able to make it, and it meant the world to me. And I can still feel sort of the excitement and the amazing energy that I experienced at that first meeting, and that's what has kept me coming back. I have been to every single meeting since, and I sincerely hope that this is the one meeting that I will never miss. This meeting is really special, and I think it has something to do with the ability to connect with other people in a way that you just can't connect with others at other surgical meetings. The interactions that we have here are really unique in that way. And it's hard to describe, but I think it has something to do with the fact that surgeons by nature are somewhat formal, somewhat hierarchical, and all through our training we are meant to communicate and sort of collaborate in a very prescribed hierarchical fashion. But when you come to East, that hierarchy, that dynamic is totally dismantled. And I love that. It's liberating. You know, as a medical student, you can walk up to the president of this organization because, you know what? They're wearing a Hawaiian shirt and jeans, and they look like they just stepped out of a backyard barbecue or they're on vacation. And somehow it allows for those true, authentic interactions. And it really does have something to do with the Hawaiian shirts. And I know it sounds silly, and you can wear whatever you want to this meeting. It doesn't have to be a Hawaiian shirt, but the idea of disbanding dress codes at surgical meetings is, I think, pretty radical. This is the only surgical meeting that I'm aware of that does not have a dress code. And what that means is that everybody can come here and wear whatever they want and be comfortable in their own skin. And I will tell you that dismantling dress codes fosters inclusivity. It means that everybody can come, that, you know, not having the right clothing is not a barrier to attendance, and everyone can be comfortable with how they're expressing themselves, all of the sort of considerations around what's professional clothing, what's allowed in terms of gender expression, you know, all of those worries and concerns just go out the window, and you just get to be here as your true, authentic self. And the truth is, when you show up and feel comfortable with what you're wearing and who you are, you bring your best self to this meeting. And that's it. It is trauma surgeons at their best, comfortable and willing to embrace anybody and everybody and really enjoy the opportunity to have that experience together. So that's what keeps me coming back, you know, that ability to be with each other in this exact time, this exact place, in a physical space together. And there's some magic in that, you know, there's the opportunity to have something incredible happen. You know, you never know who you're going to talk to, who you're going to meet. You might have some chance interaction that changes your career, it changes your life, you know, and for me, that's the special magic, you know, who am I going to meet? I'm going to be a different person when I get on the plane at the end of the week, and in what way? You know, that's kind of the question I ask myself. How am I going to change this week? What am I going to do differently? How am I going to better serve my patients? How am I going to be a better partner, a better colleague, a better teacher? what can I do differently next week that I wasn't doing last week? And it's all because of this meeting and the opportunity to grow and thrive and really embrace, the ability to learn from each other.